to treatment of fibroids. Other option is surgical. Surgery means depending on the age of the patient, whether they have completed family or whether we are treating for the fertility related management of the fibroids. Depending on the position of the fibroid, we treat either with a removal of the fibroid or removal of the uterus. Removal of the fibroid usually when the patient is very young, when they are planning to have pregnancy, when they are very young. So we do a laparoscopy. Nowadays recommendation is keyhole surgery, especially when if we do MRI, if we are not suspicious of any malignancy, we advise patients to undergo laparoscopy, keyhole surgery, fibroid removal. The other option is also a robotic surgery, where that is also minimally invasive surgery with a faster recovery and more precise. So this will helps to preserve the uterus, so helps in conceiving the future also. The other surgery is removal of the uterus when they have completed the family above 40 plus, and especially if those patients who are having multiple fibroids, once they have passed the reproductive age group, we advise to remove uterus rather than fibroid, because multiple fibroid, because small microscopic fibroids can be there which we may miss with the surgery. If it is very minute, they may grow in the future, again they may recur. So that's the reasons these kind of patients we advise removal of the uterus. The other option which are not invasive in terms of surgery, like uterine artery embolization, where the intervention radiologist will first localize the size, number, position of the fibroid, whether they can be done or not. Usually this can be done only those who have completed the family and they have finished their reproductive age group. That's a better time for them. It will reduce the blood supply to the uterus, so that it will suppress the fibroids to a certain extent. Depending on the position, the radiologist will decide and they will advise how much will be beneficial for this type of the fibroids what they have. The other intervention is radio frequency ablation, where they go and do myolysis. To certain extent they suppress. Depending on the position, number, size, we take decision.